transportation style. Pekkakucha is the term. It's actually Japanese, so it's pekkakucha. And what this is a style of presenting very quickly, rapid fire, if you're familiar with it already, but it's 20 slides, 20 seconds per slide, so about 6 minutes and 40 seconds for 3 different presenters. So we have 4 actual presenters doing 3 presentations here, but we're going to do all 3 in a row, so they'll be rapid fire, and these are going to focus on active transportation, food systems in the built environment, and then also parks as how they can be a prescription towards health. So we've got some great presenters for us on those, but they're going to flow. So just enjoy the presentation here, and then after these are done, we'll have all the presenters come up back up here for some Q&A time with them. So with that, I'm going to invite Jason Duba up, and Jason's going to kick off our first presentation. Jason is the Assistant Transportation Planner with the West Central Wisconsin Regional Plan Commission right here in Eau Claire, and he's going to start us off. So thanks so much for doing this.
Thank you, Dan. Active transportation is almost too good to be true. It makes people healthier, reduces pollution, grows the economy, and provides mobility for all. Let's look at what it is, why it's great, barriers to its use, and how we can improve to make the healthy choice the easy choice. Active transportation is walking, biking, or taking public transit, which requires walking or biking to get to and from the bus stop. In the Eau Claire area, 89% of commuters drive, and 6% commute by active modes, which is comparable to the national average. Often, when we think about walking or biking, we're thinking about recreation, getting out for some exercise. That's great, but active transportation is about traveling to a destination. When we can walk or bike to destinations, we can build physical activity into our daily routines. Some people, though, have no choice but to walk, bike, or take transit. They may be too young, old, or poor, or have a disability. Others choose active transportation for health, enjoyment, or to save money. Some would like to use active modes, but it isn't feasible where they live. America faces numerous health challenges related to inactivity, such as heart disease, cancer, diabetes, and obesity. By making walking, biking, and public transit safe and convenient year-round, we can make it easier for people to build routine physical activity into their daily lives, no matter the weather. Empowering people to walk, bike, and take transit can help our communities efficiently address numerous environmental challenges, from climate change to land use. Transportation is the single largest source of air pollution in the U.S. and is responsible for 28% of America's greenhouse gas emissions. Active transportation systems foster economic health by creating dynamic, connected communities with a high quality of life. This catalyzes small business development, increases property values, sparks tourism, encourages corporate investment that attracts a talented, highly educated workforce, and saves money by reducing spending on cars and gasoline. Cities that prioritize active transportation are helping to ensure that everyone can get where they need to go. Building infrastructure for walking, biking, and public transit means people with disabilities or low incomes, children, and the elderly can get around without a car. One reason people do not walk, bike, or take transit is fear. People are afraid for their safety when crossing busy streets or biking without a protected lane, and their fear is justified. In 2013, in the U.S., 4,700 people were killed walking, and 743 people were killed biking. American cities are designed for the car. However, 66% of Americans want more transportation options so they can choose how they travel. 73% feel they currently have no choice but to drive as much as they do, and 57% would like to spend less time in the car. Sometimes we drive because our destination is far away. Sometimes we drive because our destination feels far away. Unlike this, mixed-use neighborhoods with gridded streets make active transportation easier to use for everyday needs like work, school, shopping, and socializing because destinations are nearby and they feel accessible. We need complete streets because they are streets for everyone. They are designed and operated to enable safe access for users of all ages and abilities, including pedestrians, bicyclists, transit riders, and motorists. Complete streets make it easy to cross the street, walk to shops, bike to work, and catch a bus. We need active transportation networks that allow us to get from door to door. These networks need to be thoughtfully planned with users and their destinations in mind. The new Chippewa Valley Bike Map shows good places to go by bike and places that need more attention. Bike share system would get more people biking. This concept was presented last year at this forum, but a study from the University of Wisconsin Eau Claire recommended building up the city's bike infrastructure first before considering investing funds in bike share. Let's keep it in mind, though. The Surgeon General recently launched the Step It Up campaign, a national effort to promote walking at least 22 minutes a day as a way to obtain substantial health benefits. His report urges government agencies, city planners, and developers to design and maintain communities that are more pedestrian friendly. To enhance the pedestrian friendliness of a neighborhood or a commercial district, it needs to have three key elements: be appealing, feel safe, and provide meaningful destinations. This vision of an East Rand pedestrian promenade certainly fits that bill. It's from Decky's Downtown Eau Claire Master Plan. Children and adolescents need to be active for at least 60 minutes a day. Walking or biking to school can contribute to that amount. The Safe Routes to School program helps schools boost rates of walking and biking, which dropped from 50% in 1969 to 13% in 2009. Many people report a greatly diminished sense of freedom when they become too old to drive, while many others continue to drive past the point at which they can do so safely. Older adults who can walk, bike, or take transit where they need to go have independent mobility and are physically active. In addition to improving conditions for active transportation where people live now, it is vital to build more housing in places that are already walkable, bikeable, and have transit service. This vision for downtown living just south of the Confluence area is from Decky's plan. We have a great car transportation system. Now it's time to prioritize active transportation. Government agencies, planners, developers, businesses, public health and healthcare workers, advocacy organizations, individuals, and others need to work together to make walking, biking, and public transit safe, convenient, and fun, making the healthy choice the easy choice.
What do you think? Should we both use the mic? Is that the best way?
What if we just want to talk? If you got loud phones. Okay.
Okay.
And here's how to start it. Use the mic. It's going to. Now it's gonna go.
Okay.
I'm just gonna talk. I'll be good.
Thank you, friends, for coming today. My name is Andrew Workman, the Eau Claire City Council. I also work with the Pew Charitable Trust. And I'm joined today by Nancy Coffey, who's the UW Extension Nutrition Education Program Coordinator.
Eau Claire County currently has the highest percent of fast food restaurants per capita compared to other counties in the state. The environment around us affects the food choices we make. Currently, almost 1/3 of Eau Claire County adults and Head Start kids are overweight. With the abundance of fast food restaurants in our county, we as a community need to think about this abundance and how it affects the choices we make. A food desert is a low-income census tract where a substantial number of residents have limited access to a supermarket. Low-income neighborhoods are at a great risk of suffering from obesity and diabetes.
In 2005, the Pew Charitable Trust teamed up with Johns Hopkins and did a study looking at what are some of the main drivers in our food systems today that need to be drastically reformed. And one of the things that Mr. Fisher talked about earlier today is the role that local distributed communities can play in growing their own food, and we're going to focus on that today. In 2013, the Eau Claire City Council passed a health chapter looking at what are the ways in our community that we can make healthy choices the easy choice. And so today, we're going to look at farmers markets, food hubs. We're going to look to the future, to what's being done, and really look at how people can collaborate in helping to grow more food locally. One of the things that you're going to find in the health chapter is the fact that policy matters. And whether it's encouraging more growing in our parks, whether it's supporting farmers market, growing in boulevards, which is an ordinance we did just a few years ago, these are some of the things that policy can help drive looking into the future.
With the token program at the Eau Claire Downtown Farmers Market, food share, credit, and debit patrons can purchase tokens to shop at the market. In 4 years, this program increased market sales by $50,000. This year, Market Match was initiated. Using Market Match, for every dollar of tokens purchased by food share patrons, they received an extra $1 up to $10 per week.
One of the things that I find really exciting is when you walk around our community today, you see all the neighborhood gardens, community gardens spurring up. And the fact is, over the last 5 years, we've more than doubled the number of community gardens in our community. There's now hundreds of gardeners already putting their hands in the soil and growing their own food.
Is health encouraged at your workplace? From the reception desk to healthy vending to encouragement to take the stairs. We all can help make health a priority. Healthy Communities Chronic Disease Action Team and Chamber Wellness Program encourage worksite wellness opportunities.
Last year, UW Extension worked with AmeriCorps Vista to start a greenhouse program. And as Mr. Fisher talked about earlier as well, this is something that we need to look toward in the future because we have hard winters, and the chance for people to get inside, to be close to each other, to grow their own food in a warm environment, it's something that's not only healthy, but it lifts the spirits without a doubt.
Youth gardens run in partnership with Eau Claire Parks and Recreation, the Boys and Girls Club, and UW Extension. Children grow, weed, harvest, and prepare fruits and vegetables. When there is abundance, they take produce home. One parent stated, before the kids' garden program, my kids ate few veggies. Now they're even eating cucumbers and summer squash.
Across from the farmers market now in downtown Eau Claire, and this is on Madison Street, you'll find edible landscaping that just went in there. And this is also part of a new program. There's over 200 different fruit and nut berries planted around that parking lot. So next time you're there, have a look. By next year, hopefully some food will be growing too for everyone to pick.
Currently, 1 out of 8 of our county residents is food insecure. Food insecurity significantly increases the risk for chronic disease and increased health costs. Food share, food pantries, the community tables, school breakfast and lunch, and backpack meals help families access the food needed to be healthy. To increase awareness and assistance of community food insecurity, an e-newsletter called Hidden Hunger has been developed by the Hunger Prevention Coalition for Eau Claire County. It is emailed quarterly to community residents. Sign up today to learn how to help our neighbors access healthy food. Healthy Communities' goal is everyone living better longer. Eau Claire Healthy Communities is a local coalition made up of partners from the community working together to promote the health and well-being of individuals, families, and communities of Eau Claire County through collaborative and focused action.
In the next few slides, we're going to look a little bit toward the future and some of the projects that are happening. And later on today, you're also going to get a chance to do some tours that highlight some of these possibilities. So again, the main focus of our talks today is to focus on how do we make healthy food easy, or healthy living an easy choice. And
Green Arrows is a social marketing intervention used in grocery stores. Using green arrows in grocery cart placards, research shows that customers will increase their purchase of fresh produce. Watch for this Healthy Communities Chronic Disease Action Team initiative as funds are secured.
The Cannery District, or West Bank, is an exciting new project that I think a lot of people are already kind of aware of. The funding has just come in from all different sources to help make the first steps possible, and that's looking at a feasibility study. But really what's being looked at here is a potential food hub, a potential our winter market, and a lot of other possibilities in the tour you'll hear this afternoon.
With the Wisconsin Partnership Planning Grant, the Food as Medicine Planning Partnership was created and is now part of Healthy Communities. Members include clinics, hospitals, health insurance companies, city, county health departments, schools, and nonprofits, as well as community members who have experienced food insecurity. The goal is to increase access of healthy food for low-income residents.
It's going to be all of us working together, it really is. And the idea of distributed and the idea of building power from the grassroots, I really think that that's how we're going to see a lot of these changes take place. And I hope you're inspired by what is already happening here in Eau Claire, and you're looking toward the future to work together on more. So thank you for having us today.
I'll choose you.
Before you start, I'm just going to announce it.
Oh, yeah. Okay, you do it. Go ahead.
Do you need this?
No, I'll start it once you have your announcement.
Okay. Okay, on the ends of each of your rows, I have some flyers. One's a park page. It says Mount Simon Park, and then there's a Healthy Trails brochure that I'll be talking about as I present today. And then also Ned will be passing around. Are they going through already?
Nathan's name.
Okay, I'll talk about these in a minute.
All right.
So I can look at this.
You're good to go. Yeah, you can use this to.
Okay. Okay. Parks as health prescriptions. What is this? I'll refer to it as RX Parks. It's a new initiative sweeping our nation a little bit. And what's kind of passing around right now is a promotional tool with trail mix and Hobbs Ice Center skating pass in there to be active. Again, national trends. What we're seeing is a fight against obesity, chronic disease, and things of that nature. You know, what are benefits of RX Parks? Basically, it's health related. Losing weight, feeling less stressed, and things of that nature, as you can see on the screen. National Parks and Recreation Association has some health initiatives, and they call them the 3 pillars, even though there's more listed up here. Health and wellness, conservation, and social equity. There's others listed up there, has been addressed already today, transportation, food, nutrition. What is RX Parks, and what are we doing here in Eau Claire to work towards that? Again, it's a new program being developed. There's so many different facets that can start from the simple thing like Healthy Trails program and go all the way to a doctor's office, hopefully. Park information pages that's circulating around. Those are developed. We develop them for our community parks and our neighborhood parks here in Eau Claire. And they talk about the different features, amenities, attractions, how to get to the parks, maybe a little bit of history about the park. These are hopefully going to be used as resource tools in our community. Where do we want to take this? We'd like to take this all the way to the doctor's offices, where doctors are actually writing prescriptions or doing tear-off sheets to give information about our parks. This is not what we would unveil, but it is a sample of what we were talking about. Perhaps writing a prescription to go take swim lessons. Healthy Trails. Healthy Trails program is a partnership program with Mayo Clinic Health System. As a pilot program, as you can see in your brochure, we're offering 3 dates, one in September, October, and November. We have one this Saturday at 9 a.m. at Phoenix Park, if you'd like to join us. Also, working with Mayo Clinic Health System, we got a grant to open Owen Park Fitness Zone, and this is a picture of what's going up in Owen Park next to the playground. It features 9 stations with instructions on the different various things you can do. Okay, so how do we prescribe parks? Well, there's so many different ways to look at it. So again, thinking out of the box. Providing healthy food resources. So Feed My People, the farmers market, and things of that nature. We do kids' meals at our playground program. Kids' meals go to Home with Kids in the summer. We can prescribe our trail systems. Our trail systems connect. We have over 28 miles of trails here in Eau Claire alone that connect up to the Chippewa River Trail, which connects to the Red Cedar and the Old Abe trails as well. So promoting walking, biking, jogging, take your dog for a walk, things of that nature. How can we prescribe our waterways? Well, with the development of Phoenix Park, our waterways are being used more in Eau Claire, more and more, I guess, every year. So what can we prescribe? Well, number one, water safety, boating, fishing. Tubing is a little bit sketchy, but you could promote that. Different ways to use our waterways. Hockey, we have facilities. We have a pool, we have a Hobbs Ice Center. So what we prescribe here, not necessarily playing hockey, I just like that picture, but we can prescribe open skate, open hockey. We have different family events for youth and families at Hobbs. Fairfax Pool, as I kind of alluded to earlier, water safety. Prescribing a safe place to swim. Fairfax Pool has an excellent record at that. Prescribing swim lessons. It would be great to see pediatricians prescribe swim lessons to kids as they come through their offices annually. That's an example of where we'd like to go. How do we prescribe the other things in our community? Because it's not just activity, it's social, it's mental stress release. So we have over 107 special events in Eau Claire alone that would involve running, walking, biking, music festivals, and things of that nature. Also, art. We have art, Chalk Fest. We have a sculpture tour. Go walk downtown, go walk on Water Street, check out the sculptures. We also have a planet walk. The sun is located in Phoenix Park, and Pluto is located at Schneider Hall. All of this revolves around kind of that key to transportation accessibility. These are just examples of accessibility, barrier-free playgrounds with play surfaces that are accessible. Fishing pier at Carson Park is accessible. Bike lanes and trails are also being maintained throughout our community. National trends. You can see there's a list of national trends, but one is protective bike lanes, adventure programs, river walks, bike walks, and then active activities for older adults. And pickleball is taking our community by storm. This is a duplicate slide, right? But the Surgeon General, his program is basically Step It Up. It's the national call to action. Basically, people can walk anywhere at any time with anyone. So I think that's kind of where we'd like to see Eau Claire go in the next year, is promoting walking as much as we can. Other things we'd like to do locally. We had a glow ride this last weekend. We had 50 people come out to do our very first glow ride. The mobile rec van you see in the middle, taking recreation out to our neighborhoods to play with kids and get them active, maybe do some, if kids are playing, they're active and they're losing weight and they may not even know it. And so that's kind of where we'd like to go. So basically with that, how can we make, or you make in your communities, our X-Parks work? Prescription to live life better. Thank you.
All right, that challenged our presenters with the rapid fire 20 seconds per slide. So great job, everyone. We're going to have time for just a few questions now to stay on agenda. So all four presenters are here on the various subjects. If you have questions, we do have our volunteers that pass around mics. Just hold up your hand.
Hi there. Thanks, everybody. You did well with that speedy presentation. But what I would like to see in Eau Claire is, I don't think it's safe to walk around here. It's hard to get across the street sometimes. One of the confusing things is if I'm in a car and I'm going straight ahead and I have a green light and the person crossing the street to my right has a white human light walk sign. So I've seen lots of close calls. So I think our pedestrian laws, one, are not observed, and two, are confusing. So what can we as a community do about that? Also, people don't stop. I don't know the difference between these lines that are perpendicular to the road, two lines that go across the road, versus the bars that cross. Nobody stops at any of them. Oh, occasionally. But anyway, I think it'd be good if we did something to make it safer to walk.
There are numerous issues there, and we could talk a lot about
all of them. Just to sum up, basically, though, there are problems with our infrastructure, with our streets and our crosswalks and our stoplights and walk lights. Yes, we need to fix those, and there are good ways to do those. It's not like we don't know how to do it. There are problems with enforcement. That has to do with law enforcement. And there are issues with how we drive as individuals, and how as a community we treat crosswalks and pedestrians. And those are all issues that come together.
Yeah. How do you make people in the community aware of the opportunities that your organizations are developing? Is there any outreach sort of activity?
That's always a problem. We think we're getting the information out, and we aren't always as well as we could be and should be. So as a community, I think that it's really important if you do know about programs, like, for example, any programs for food assistance. We do have a Hunger Prevention Coalition community resource directory, as well as food resource maps to help people understand where they can get food if they need it and cannot afford it. And for many of us, we think those have been out forever, and they're in a lot of different venues in our community, and yet we still know there are people that probably don't know about all of them, as well as 211, which also, if people call, they can get assistance.
And as for RX Parks, I think that's such a new initiative. We're trying to partner up with health providers. Thus far, we are working with Mayo Clinic Health System, but we're planning to reach out in the next few months to some of the other health providers and hopefully send our message out that way.
One of the in terms of the community gardens and people's connection to those, we've been full. All the different community gardens have been full for the past few years, to the point where we haven't even been able to spread the word just generally, because so many people will call and contact. And I think the capacity that is huge potentially. But in the past, when new gardens have started up, for example, there's a Southside Garden now in Fairfax. The news has covered that. That has been the city website. Oftentimes is a link, and then we have a website that helps people connect to their gardens in their community. But the other thing is we work. The Forest Street Community Garden works with the community table, and that's a way that a lot of people hear about the garden. And so people come through, walk through, and say, "How can I join? How can I get involved in this?" But to be honest, like, the information piece of this is still getting figured out, and I suspect that the number of people in our community that really want to be a part of growing their own food is just enormous, and we're just trying to handle that, I guess, in some way.
Andrew, just a really quick question. You mentioned the Boulevard project. I'm not quite sure what that is. And the second thing, just to add to the woman who talked about people not following the rules and, nobody knows what's to do with the crosswalks. I got to tell you, as somebody who bikes, I've been almost hit several times because people don't follow the rules when there's a walk sign and you start going. They'll look to the left, and then they start turning before they look to the right, and then you're almost taken out. So maybe something just as simple as spring's coming up, you do like a commercial that says, hey, people are going to be out walking more, bikes are going to be here, these are the rules, just to make people aware again. But my other one is the Boulevard and what the heck that is.
And I have to apologize because I haven't looked at the ordinance for some time, but I believe that it says that you can plant whatever you like in your boulevard as long as it's not more than 50%. I believe that's true. And so before you wouldn't be able to just go and plant perennials or edibles in your boulevard outside of your house, it had to be pretty much a grass strip. So we changed it to say, as long as you're not quote unquote monocropping your boulevard, you're able to plant it how you like. So there's an ordinance. It's a little lengthy, but if you go around town, you'll see people are actually utilizing it, and a fair number of boulevards, I can even think of some of the folks here today, are being planted up with different things. So I think you want to.
Just one idea for those pedestrian crosswalks where cars are turning right. A lot of cities have a system where the pedestrian gets their go signal first. The cars have to wait for a couple seconds before they can turn, so the pedestrian is already into the crosswalk and visible by the driver, and makes it safer that way.
The United States has 29% of the population has brain disorder, and that would include mental health. And I understand in Eau Claire that mental health is a major issue. And one of the things that wasn't talked about is air traffic and what impact that has on the population, and where we're placing cell towers, where we're putting radio towers and nuclear plants. All that has an impact on the brain. Now, one of the things, too, I mean, if we think about brain disorders, too, and the amount of air traffic, even internally and externally, I mean, there are health issues both external and internal. So from a transportation standpoint, are you tracking the number of accidents because of the cell towers being located right next to the highway? Are you tracking the number of GPS systems that are in the cars that possibly may cause a cardiac arrest for someone? The other thing too is from a council standpoint, one of the things that I would be tracking, and also for Dr. Linden, and I don't know if he's still in the building, but one thing that I would recommend is that every hospital, every clinic should be tracking the amount of what kind of mental health disorder or brain disorder is occurring within a certain proximity to a cell tower or radio tower. And naturally, none of us want to have that be public information, but it should be tracked internally and sent to a repository within the state so they can determine whether or not it's an environmental health and safety issue or a security problem. So what all I'm doing is recommending that some policy be put in place along with some zoning ordinances that would track that before those cell towers and radio towers went up. Thank you.
And I don't know a lot. We don't currently there isn't any tracking of that sort. But the thing is that I think what's important today about the talks that have been given and the work that's being done in our community is that mental health, I think, is it actually has some of its roots in some of the issues that are today happening in our society. And when you look at the idea of parks where people can come together and play, movement, how that impacts you, what food does in terms of your mental health, and how you feel when you connect to other people and the food that you're growing, or even being able to get out and bicycle to work. Those things, and you can talk to doctors and you can talk to health professionals, and they'll tell you those things are key when it comes to mental health. So there may be some negative impact on some of those other things that you're talking about, and they might be minor, but I think today what we're talking about is really these huge players in mental health today in our community, and honestly, food and movement and community are big, and I think that's kind of the main focus today.
Let's wrap this up. Thank you again for presenting the 20 by 20. We're going to have a break now, but before we dismiss, we have 3 different options for you. So take a quick break, but the 3, if you've read in the program guide, there's 3 different options. The one, health impact assessment, is going to be right here, and that's going to look at specifically the health impacts at the Cannery Redevelopment District, which is not too far away from here. We'll also take a walk audit of that built environment feature and analyze that and talk about it. So that's going to be right here. Group Health Cooperative of Eau Claire, they're going to be presenting in terms of making the healthy choice, the easy choice at work, so workplace wellness, but then also how you can translate that back in the home environment. So for those folks that are interested in that, can I get a show of hands? We got the second. Okay, looks about maybe 20 or so. So I think what we'll do based off of that count is change rooms. And there's a closer room over here. I think it's conference room 1. I believe it's just by the bathrooms. And we'll go into there, those participants, and have a good presentation with Group Health Cooperative of Eau Claire. So go to that presentation if you're interested in that. And then lastly, the neighborhood tour, that is over in Altoona. And so we'll probably have you start at that at 3:45 just to be able to get to your car here and get over there. And so if you're interested in that, the developer, Bill Albright, who actually was a panelist last year here, will guide you through that development. It's a multi-generational lifestyle type development on a former golf course. And he'll also point out active transportation features, trails, other amenities as part of that development. So you can meet him on site there with that. But there's food still left over, and we're going to get back then for the 2 workshops in this facility. We will get back together, I would say, probably in about 10 minutes. So 3:25, let's be back together to start up that. Thank you.